Korsakoff syndrome. Imagine walking into a bar, greeted warmly by the bartender who then serves you a drink. 10 minutes later, he looks at you with confusion, as if you've just entered the bar for the first time. This situation can be bewildering, and the bartender's behavior may raise questions in your mind. The reality is that he is likely experiencing Korsakoff syndrome, a rare neurological disorder characterized by severe memory impairment. Korsakoff syndrome predominantly results from a deficiency in vitamin B1, also known as thiamine. This deficiency can severely hinder brain function, leading to both retrograde and anterograde amnesia. The former refers to the loss of existing memories, while the latter pertains to the inability to create new memories. One of the hallmark symptoms of this condition is confabulation, where the brain attempts to fill memory gaps with fabricated stories, creating a false narrative to account for the missing pieces. This syndrome is most commonly associated with individuals who consume alcohol excessively, as alcohol can impair thiamine absorption and damage brain tissue. However, it's not limited to heavy drinkers. Korsakoff syndrome can also affect those with severe malnutrition, extended periods of vomiting, or anorexia. The good news is that Korsakoff syndrome is treatable if identified early. Treatment typically involves thiamine supplementation, a balanced diet, and abstaining from alcohol, allowing for potential recovery of lost memories and improved cognitive function. It's akin to correcting a typographical error before sending an important email. Catching it early can make a significant difference. Cotard's delusion, also known as a walking corpse syndrome. Imagine waking up one morning and instead of the usual thoughts about your day, your mind tells you that you're actually a corpse, outright deceased. While this may sound absurd to most, individuals suffering from Cotard's delusion genuinely hold this belief, often insisting that they are dead, missing vital organs, or undergoing decomposition. First described in 1880 by French neurologist Jules Cotard, the condition was initially termed le déni de la négation, or the delirium of negation. This term essentially captures the essence of the delusion where the individual denies their own existence in the most extreme manner. It's important to note that this is not merely an exaggerated joke or a Halloween scare. Rather, it is a serious mental health condition. People with Cotard's delusion may express a range of disturbing beliefs about their state. Some think they are rotting, while others might feel that the Grim Reaper has left their job unfinished. This can lead to drastic behaviors, such as neglecting basic self-care. They might stop eating, breathing, or leaving their beds, rationalizing that there is little point in performing these actions if they are indeed already dead. One of the most well-known cases is that of Mademoiselle X, a 19th-century French woman who became so convinced of her own death that she refused to eat and insisted on being taken to the morgue. It was only due to the insistence of those around her that she survived, as they refused to accept her death. Cotard's delusion is not the result of supernatural forces, rogue witchcraft, or a zombie infection, but rather it is associated with serious mental health issues such as severe depression, brain injuries, schizophrenia, and neurological disorders like epilepsy or multiple sclerosis. Fortunately, Cotard's delusion is not an irreversible condition. Treatments including antidepressants, antipsychotics, and various forms of therapy can help restore the individual's grasp on reality, allowing them to reconnect with their living self and improve their quality of life. Balint syndrome. Imagine yourself at an all-you-can-eat buffet with an array of delectable dishes, pizza, cake, and more. You're ready to dive in, but as you reach for a fork, your hand behaves erratically, almost as if caught in one of those frustrating claw machines. Instead of seeing a tempting spread of food, your vision seems to narrow, allowing you to focus on just one dish at a time. This scenario is reminiscent of what individuals with Balint syndrome experience. Balint syndrome is a rare neurological disorder resulting from damage to both sides of the parietal lobe, the brain region responsible for spatial awareness, movement, and the relationship between yourself and objects in your environment. In essence, it's like your brain's GPS and multitasking system have gone haywire. Those with Balint syndrome may encounter 3 significant challenges, often referred to as glitches in their cognitive processing. Simultanagnosia. For instance, you might find yourself staring intently at a single leaf on a tree, while the entire forest fades into the background, much like a poorly blurred Zoom video. This inability to perceive multiple stimuli can make navigating environments incredibly difficult. Optic ataxia. It's as if your hands and eyes are no longer on speaking terms. You may spot your coffee mug easily, but when you go to grasp it, your hand reaches out into thin air, illustrating the breakdown in coordination that can occur with this syndrome. Ocular apraxia. Individuals may struggle to look around voluntarily, making it challenging to shift focus from one object to another in their visual field. It's important to note that Balint syndrome is not a congenital condition. Rather, it typically arises from bilateral damage to the parietal lobes, which can be caused by various factors such as strokes, traumatic brain injuries, or neurodegenerative diseases like Alzheimer's. Prosopagnosia. Picture yourself waking up one morning to find a house full of animated strangers, all engaging with you as if you are lifelong friends. They invite you to breakfast, but as you scan the room, your brain struggles to recognize anyone. It's not because you've forgotten them, it's that your mind simply cannot process their faces. In fact, the only familiar face you can identify is your own, looking back at you in photographs among these unfamiliar people. These strangers turn out to be your own family members. Prosopagnosia is a neurological condition that makes recognizing faces a daunting task, often compared to trying to solve a Rubik's Cube while blindfolded. It's essential to understand that this isn't simply a matter of poor memory or vision. The brain's ability to process and recognize faces is impaired. Individuals with prosopagnosia might find it challenging to identify even close friends and relatives. Most cases of prosopagnosia exist from birth and are referred to as developmental prosopagnosia. However, the condition can also arise from damage to the fusiform gyrus, a specific area of the brain associated with facial recognition. Imagine the repeated embarrassment of not recognizing your partner or failing to identify friends at social gatherings. They might rely on distinctive features such as voice, hairstyle, clothing, or other unique attributes, like moles or glasses. However, even minor changes, like a new haircut or someone shaving their beard, can throw them back into a state of uncertainty. Anton-Babinski syndrome. Anton-Babinski syndrome is a neurological disorder where individuals are completely blind but strongly believe they can see. They navigate life confidently, insisting they can perceive the world despite clear evidence of their blindness. This syndrome usually occurs after damage to the occipital lobe, the part of the brain that processes visual information. Such damage can result from strokes, brain injuries, or tumors. Your brain doesn't know it's blind, so it just assumes everything is fine and dandy, filling in the blanks like a bad artist sketching a masterpiece with crayons. It's like when you hear a muffled conversation in the next room and make up wild theories about what's being said. Diagnosing this syndrome is challenging because patients often deny their blindness, making it hard for medical professionals to communicate effectively about their condition. Currently, there is no specific cure for Anton-Babinski syndrome. Treatment focuses on addressing the underlying causes, like stroke or trauma, and helping patients accept their blindness to improve their quality of life. Semantic dementia. Semantic dementia, SD, is a rare neurodegenerative disorder that gradually causes people to lose the meanings of words, objects, and concepts. It's like the brain is trying to clear out its dictionary, but this leads to confusion. For example, someone might struggle to recognize a cat or think that a coffee mug is just a small hat. At first, semantic dementia may show up as slight mix-ups in language, like calling a dog a horse or referring to a pineapple as a spiky orange ball. As the disease advances, individuals may forget the meanings of words altogether. Unlike Alzheimer's, which often leads to forgetting people and events, semantic dementia mainly affects understanding without immediately impacting daily memories. Unfortunately, there is no cure for semantic dementia, but don't lose hope just yet, because the treatments focus on managing symptoms, and even though you might forget words entirely, the condition can't erase the moments, so just call everything a thingy and keep living. Akinetopsia. Imagine watching a high-speed car race, but instead of seeing cars zoom by, you only see individual snapshots, like a flipbook with missing pages. This condition, is known as Akinetopsia, occurs when the middle temporal visual area of the brain, which helps process motion, is damaged, often due to a stroke, head injury, or neurodegenerative disease. As a result, objects and people seem to jump from one position to another, much like a glitchy video game. Everyday actions like pouring coffee or crossing the street can become very challenging, as it's hard to judge how fast things are moving. Currently, there is no cure for Akinetopsia. Rehabilitation focuses on adapting to the condition. Patients might learn to rely on sounds instead of sight for cues about movement and break tasks into smaller steps to make them easier. Avoiding fast-paced or crowded environments can also help manage the challenges of this condition. Apotemnophilia. Imagine waking up and feeling like your right leg is an intruder. It's functional, but it feels alien, like receiving an extra phone charger you never ordered. People with this condition often experience a strong desire to amputate a limb in order to feel whole. Though it may seem strange to want to remove a perfectly good body part, the reasons behind this desire are not fully understood. Some theories suggest that it may relate to deep psychological issues, unresolved trauma, or obsessive thoughts. It's not that individuals hate their limb. It simply doesn't feel right to them, similar to wearing shoes that are too tight. They may identify as an amputee at heart, and removing the limb feels like the only way to align their body with their identity. The desire for amputation usually develops gradually, with some individuals even pretending to be amputees by using crutches or wheelchairs. In extreme cases, this can lead to self-amputation, which is a serious and devastating action. Unfortunately, apotemnophilia is often misunderstood and confused with body dysmorphic disorder or self-harm tendencies due to its rarity and unusual nature. Aphantasia. This condition in which individuals are unable to create mental images voluntarily. While most people can close their eyes and vividly imagine things, a juicy red apple, a playful puppy, or their dream home, those with aphantasia experience complete darkness when trying to visualize. Their mind's eye feels more like a mind's blind eye. It's important to note that people with aphantasia are not lacking in creativity. They simply process information differently. Rather than creating visual representations, their brains tend to focus on facts or bullet points. To use an analogy, while most people have a mental projector that plays movies of their imagination on demand, those with aphantasia have projectors that lack bulbs, so no images can be projected. The term aphantasia was only coined in 2015 by neurologist Adam Zeman, who discovered it after a patient reported losing their ability to visualize following surgery. Surprisingly, many people live with aphantasia and are unaware of it, leading them to wonder why others can so easily picture things. Estimates suggest that about 1% to 5% of the population may have this condition. This means that in a room of 100 people, 1 to 5 might be experiencing the challenges of visualization, much like trying to explain colors to someone who has never seen them.
Thanks for watching. I hope you like it. Next video will be coming soon. Bye!